Senator Monning.
Thank you, Madam President. Members, SB 945 establishes minimum standards for the care of pets while they are in pet boarding facilities. It was surprising to me to learn that there is nothing in law addressing pet boarding facilities, and I suspect that most pet owners who board their pets are unaware that California does not have any standards of care in law. The level and quality of care at pet boarding facilities varies widely. While some facilities are exemplary, providing safe and loving environments, others do not meet basic standards. There are many tragic stories of animals being severely injured or even perishing at boarding facilities due to neglect or poorly maintained equipment. Many pet owners view their pets similar to how parents view their children, and tragedies can be avoided if minimum standards of care are established. Members, I respectfully ask for your aye vote.
Debate or discussion? Is there any debate or discussion on this item? Seeing and hearing none, Mr. Secretary, please call the roll.
Allen? Aye. Anderson? Aye. Bates? Aye. Bell? Berryhill? Block? Aye. Canella? Aye. DeLeon? Fuller? Gaines? Galgiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? Aye. Jackson? Aye. Lara? Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? Morell? Wynn? Aye. Nielsen? Aye. Pan? Aye. Pavley? Roth? Aye. Runner? Stone? Aye. Vidak? Aye. Wykowski? Wolk?
Please call the absent members.
Bell? Berryhill? Aye. DeLeon? Fuller? Gaines? Lara? McGuire? Aye. Morlock? Morell? Pavley? Runner? Wykowski? Aye. Wolk?
Call Gaines again.
Please call the absent members one more time.
Bell? DeLeon? Fuller? Gaines? Lara? Morlock? Morell? Pavley? Runner? Wolk?
Ayes 30, no 0. The measure passes. File item 37, Senator Pan. Pass on file. File item 38, Senator Hueso. Mr. Secretary, please read.
Senate Bill 1041 by Senator Hueso, an act relating to energy.
Senator Hueso.
Thank you, Madam President. A number of California schools have recently experienced sharp increases in their electricity bills. As supporters of this bill can attest, upwards 30% have seen increases in some parts of the state. According to representatives of those schools, the increases have come about in large part because of rate increases in the form of demand charges. This bill would require electric companies to come up with a rate that is specific to schools. We don't need our schools subsidizing anyone else's electricity. They should receive the electricity at a rate that is pertinent to the way they operate and what their needs are, and what it costs those utilities to deliver the energy. This bill would require that the costs be, in the full amount that it requires the utilities to provide those services or those electric services. The electric rates paid by our schools should reflect the cost to provide the service of those schools, not the cost to serve the commercial or industrial class of customers, since schools are usually put in either a commercial class or an industrial class. This is not reflective of their needs and oftentimes requires them to pay fees that are higher than what they deserve. I believe that we should allow our schools to pay the fees commensurate with the services they receive. If we do that, we will see substantial savings across the state for all school districts. They should be putting their money into the classroom and not in the electric fees and bills. So please join me in supporting our schools and supporting SB 1041. Thank you.
Thank you, Senator Hueso. Debate or discussion? Senator Morell. I'm sorry, excuse me, Senator Morlock, followed by Senator Stone, who's sitting next to Senator Morell. It's as good as I can get. Senator Morlock.
From somewhere down south. Thank you, Madam President.
Orange County, actually.
Colleagues, I may be misreading this bill, but I just wonder if we reduce the rates and fees for schools, won't it raise rates somewhere else? And don't schools already receive property taxes and Prop 98 funding? And it seems like the more we cut our water use, our water bills still go up. We have a static bottom line that our utilities are trying to achieve. So if we're not buying enough water, they have to raise the rates so that we haven't, at the end of the day, done anything to help ourselves. And the same, I believe, is true for electricity. If we're going to give a discount to one particular industry, then it's going to start impacting others. So I may be missing something, so I look forward to the senator from San Diego helping me out. But if rates then go up to somehow offset the reduction for schools, who does that impact? Well, I would say the poor. It would impact 4 out of every 10 residents that pay for electric bills. So I see this as an idea that, you know, I understand that it's a great idea for schools, but we're all being encouraged to get off the grid and acquire solar equipment to reduce our electric use. And if we're going to reduce rates for the schools, what incentives do they have then to adopt solar opportunities as well? So with that, Madam President, I'm just raising some concerns, and at this point, I'm a no vote. Thank you.
Thank you, Senator Morlock. Senator Stone.
Thank you, Madam President. If we're going to pass along some discounts to school districts at the expense of industrial and commercial users, it means that in all likelihood the rates of our businesses are going to go up at a time when one of the #1 reasons for businesses fleeing the state of California is our high utility rates, in particular electricity. This is only going to exacerbate our problem. When you look at the Prop 98 funding that the good senator from Orange County brought up, we are funding our schools very well. And there are incentives out there for them, like many school districts in my district, to put solar panels on the school to decrease their electric bills. I applaud the author in trying to do what he can to reduce school district expenses, to get more resources into the classroom, but to saddle higher costs on businesses, yet giving them another reason to flee the state of California, is something that my constituents and I can't support. And for that reason, I urge a no vote.
Thank you, Senator Stone. Further debate or discussion? Seeing and hearing none, Senator Hueso, you may close.
Thank you, Madam Chair. Unfortunately, there's quite a bit of misinformation going on. This would not lead to increases for the industrial or commercial class. This will simply require that they balance the way they charge fees accordingly. Now, we all know that our schools are taking measures to increase energy efficiency. We're actually spending money to create energy efficiency in our schools. And schools who are adding solar to their portfolio aren't benefiting from that solar as they should, according to these current rates. And that's unfair. If people look at simply comparing apples to apples and say, we should charge them what they are consuming, we are charging them the electricity they consume during the time they're consuming it, then they should get lower rates. Why are we going to subsidize anyone's electricity through our schools? I think that's unfortunate that we would, when making a decision about educating our children, and let's say a commercial or industrial use, somebody would decide a commercial industrial use over our children if that was the choice. But that is not the choice today. The choice is simply allowing them to create a rate that's commensurate to what they should be charged, and at the time they're be charged this rate. Schools operate during the day, and during the day they're deriving solar power. During the day, we have lower rates. Those are the rates they should be paying for the time they use their power. At the time they should be charged for when they use the power, which is during the day when they qualify for cheaper rates, as opposed to charging them a rate that is averaged over the course of a year. I think it's unfair. I think they'll come up with a policy that gets to making sure everybody's needs are met according to how their needs need to be managed in the state. This is a good bill. It's in support of our schools, but it's also in support of the energy grid to make sure we manage it more carefully, to make sure everybody gets a fairer rate in utility bills. Thank you.
Thank you, Senator Way. So all debate having ceased, Mr. Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Bates. Aye. Bell. Berryhill. Aye. Block. Aye. Canella. Aye. De Leon. Fuller. Gaines. Aye. Galgiani. Glazer. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Huff. Aye. Jackson.
Aye.
Aye. Lara. Aye. Leno. Aye. Leyva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. No. Morell. No. Wynn. Aye. Nielsen. Aye. Pan. Pavley. Aye. Roth. Aye. Runner. Stone. No. Vinak. No. Wykowski. Aye. Wolk. Aye.
Please call the absent members.
Bell. De Leon. Fuller. Galgiani. Aye. Pan. Runner.
Ayes 31, noes 4. The measure passes. Colleagues, we're going to go to file item 52. Then we're going to take up file item 58 and go back to motions and resolutions. We're going to try to be done by 3 o'clock. We have 2 more items we're going to take up on today's calendar, starting with file item 52. Senator Pavley. Mr. Secretary, please read.
Senate Bill 999 by Senator Pavley, an act related to contraceptives.
Senator Pavley.
Yes, thank you very much, Madam President. I'm really thrilled to have so many co-authors on this floor with me today to present Senate Bill 999. It's an important women's health bill designed to provide greater access to FDA-approved contraception and reduce unintended pregnancy in California. This bill requires all public and private health care service plans and health insurers to cover up to 12-month supply of FDA-approved self-administered hormonal contraceptives at one time. And I want to emphasize up to 12 months. It leaves to the discretion of the pharmacist or the doctor who's prescribing these hormonal contraceptives their discretion on whether to give them a 1 month or 3 month or 12 months. It's up to 12-month supply. It doesn't expand coverage in any way. It simply changes the timing of dispensing contraception. Many women are faced with difficult choices of running back to the doctor, renewing their prescription, or refilling their prescription on a 30-month period. It's created problems in many ways. Sometimes it's just shortages of providers and access to care. Sometimes it's because women live in rural areas or lack needed transportation. Sometimes it's because women are juggling going to work and children's and scheduling, and they can't race to the doctor. The last thing we want is unintended pregnancies, abortions, or any of the other problems that come with this. Currently, health insurance companies and plans must limit their coverage of birth control to 1 or 3 months supply. Oregon and other states have changed this to make it up to 12 months. The benefits of annual dispensing are nationally recognized and recommended by the Centers for Disease Control and the American Congress of Obstetricians and Gynecologists. Just recently, the California Health Benefits Review Program found that fewer unintended pregnancies and office visits would save industry, government, and consumers over $42 million a year. The program also estimates that annual prescriptions would result in 15,000 fewer unintended pregnancies and thousands fewer abortions each year. The idea of annual dispensing is not new to our state. You may not have known that Family Pack program for low-income women has successfully provided 12-month dispensing for 20 years. And as of February of this year, it is now required of all managed care plans in the state. SB 999 builds upon these efforts and requires it statewide. I'm delighted to have 3 co-sponsors on the measure: Planned Parenthood affiliates of California, the California Family Health Council, NARO, Pro-Choice America. This bill also has support of the California Medical Association, Health Access, Physicians for Reproductive Health, and the American Congress of Obstetricians and Gynecologists, and a long list of others. Respectfully ask for your aye vote.
Thank you, Senator Pavley. Debate or discussion will start with Senator Hertzberg, followed by Senator Leno. Senator Hertzberg.
You know, this weekend, I don't know if members had an opportunity to watch television, but there was a show about Lyndon Johnson and about the fight for civil rights and the fight for voting rights. And it's easy today, just a few years later, to not remember the fight and how hard it was and the sacrifices that were made. You know, poll tax and all these things that we wouldn't even think of today were just yesterday. And I only share that in the context of this measure that Senator Pavley has introduced on this floor today, because it represents a much deeper fight, a fight where there was veto after veto after veto of the underlying right of the Contraceptive Equity Act that Elise Thoreau of her office worked with me 20 years ago on, and we continually had it vetoed, resulted ultimately in federal action, the Hobby Lobby case, which became very famous. And so this is really one next step of practicality on this important march to fairness. Fairness that treats women equally. This measure was, I think, was AB 61 because it was 1961 where this was approved by the FDA but not approved contraceptives approved by the insurance companies to actually cover it. It's been a long fight, and I just want to acknowledge the author. I want to share with everyone here how important this long fight has been, and this is another important and yet practical step in the march forward. I urge your support of this measure. Thank you so much.
Thank you. Senator Leno.
Thank you, Madam President. I'll be very brief, given that this is such a reasonable, thoughtful bill. Over 90% of American women use contraception. So why are we, through our public policy making, denying those health professionals that serve these women the opportunity to use their own good judgment to offer a prescription for more than 30 days? If our desire is to have fewer unwanted pregnancies, to have fewer abortions, then this bill is the way to go. The opposition says any kind of mandate will drive up costs. But as Senator Pavley, the author, has already shared with us, nearly $43 million a year, it has been determined through a review and report, would be saved each year. This will save health plans money. It will not drive up costs, so it is a false argument. I ask for your aye vote.
Thank you, Senator Leno. Senator Leyva.
Thank you, Madam President. I rise as a proud co-author of this bill, and really just to say, as a regular working woman, how much easier this would make my life and hundreds of thousands of women's lives, because 30 days comes up really quickly, and to have it for a whole year would make our lives so much easier. So I thank the author for allowing me to be a co-author and urge an aye vote.
Thank you, Senator Laver. Senator Gaines.
Yeah, thank you, Madam President and members. I rise in opposition to this, and there is a cost concern. And if a woman does go in for contraceptives, what if it doesn't work? What if it's an inappropriate type of contraception, and you've provided a prescription for 12-month supply? So when we take a look at the cost aspect of this, why is America's healthcare, America's health insurance plans in opposition? So from a cost perspective, I believe this is going to cost more, actually increasing your health insurance costs, and I'm in opposition. Thank you.
Thank you. Any further debate or discussion? Seeing and hearing none, Senator Pavley, you may close.
Yes, thank you very much. Obviously, respectfully ask for your aye vote, but just want to reiterate that it maintains the discretion and the authority of the doctor or the pharmacist to decide whether to issue the prescription for 30 days or 90 days or up to a year. They retain that authority based on their patient. They know best. On behalf of women who don't want to race back to the pharmacy every 30 days, ask for your aye vote.
Thank you, Senator Pavley. Please call the roll.
Allen? Aye. Anderson? No. Bates? Bell? Aye. Berryhill? Block? Aye. Cannella? Aye. DeLeon? Fuller? Gaines? No. Galgiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Weso? Aye. Huff? Aye. Jackson?
Aye.
Aye. Lada? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? Aye. Morrell? No. Wynn? Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? Stone? No. Vidak? No. Wykowski? Wolk? Aye.
Please call the absent members.
Bates? Berryhill? Aye. DeLeon? Fuller? Wynn? Runner? Wykowski?
Ayes 28, no 6. The measure passes. Colleagues, we're going to do one more bill at the request of Senator Morrell. We are going to take up file item 58. Mr. Secretary, please read.
Senate Bill 1305 by Senator Morrell, an act relating to transportation.
A simple bill.
This is a simple, non-controversial bill, and it'll just take a little bit longer than the last one, so thank you. SB 1305, good afternoon. This bill really is non-controversial, makes modifications to the organizational roles and responsibilities for San Bernardino Association of Governments, or known as Sandbag. It is a local bill. It's passed the Senate Transportation Committee perfectly, all aye votes. Therefore, today, I ask for your aye vote on SB 1305 to help our county. Thank you.
Thank you, Senator Morrell. Any debate or discussion? Seeing and hearing none, is there any objection to substituting a unanimous roll call? Seeing and hearing none, ayes 38, no 0. The measure passes. Colleagues, we're going to lift the call on file item 17. Please call the absent members. File item 17.
Bates? Berryhill, Canella, De Leon, Fuller, no. Gaines, no. Galgiani, Huff, Lou, Mendoza, Morlock, Morell, Wynn, Nielsen, Pan, Pavley, Aye, Runner, Stone, no. Roth, aye to no.
Please call the absent members.
Bates, Berryhill, Canella, De Leon, aye. Galgiani, no. Huff, Lou, aye. Mendoza, Morlock, Morell, Wynn, Nielsen, Pan, Runner.
Ayes 21, noes 8. The measure passes. Blackjack Hill. Under motions and resolutions, colleagues, we're going back to motions and resolutions. There are floor amendments at the desk. They will be deemed adopted. Under motions and resolutions, floor amendments at the desk, they will be deemed adopted without objection pursuant to Joint Rule 33.1, Joint Rule 61, Subdivision A will be suspended to allow the Agricultural Committee to meet on Tuesday, May 24th, 2016, after the deadlines. This request has been approved by the Rules Committee. All right, colleagues, this is now the time for adjourn in memory. Do we have any adjourn in memories? Senator Block. Adjourn in memories, please, colleagues.
Thank you, Madam President. Many of you know Ryan Pessa. Ryan is staff to our Legislative Jewish Caucus. Today, I sadly rise to adjourn in memory of his father, Dr. Benjamin Pessa, who peacefully passed away on Wednesday, April 26th, after a long battle with prostate cancer. Benjamin immigrated to the United States from Egypt after spending 3 years in an Egyptian internment camp during the 1967 Six-Day War between Egypt and Israel. Benjamin, his older brother and father, along with the remaining Jewish male population in Egypt, were sent to internment camps because Egyptian government officials feared they would support their fellow Jews from Israel. In 1970, the Red Cross assisted with releasing the families from Egypt to France. Shortly thereafter, Dr. Pessa left France for San Francisco, where he was reunited with his mother and sisters. After adjusting to his new country and customs, Benjamin applied to California College of Podiatric Medicine and graduated with a medical degree in 1976. A few years later, Benjamin moved to San Diego to finish his residency at the Marine Corps Recruit Depot. Eventually, he found his way to Imperial Beach, where he opened his own practice. A few years later, he married his wife, Mira, and had 2 children. His family was his pride and joy. Dr. Pessa continued to pursue his passion for medicine and care by running his practice for over 35 years, making regular visits to skilled nursing facilities and house calls to bedridden patients. Everyone who interacted with him, including his patients, loved him. Those who knew Benjamin would describe him as a kind, sweet man who was extremely generous. He was an outgoing person and loved to be surrounded by people, especially his friends and family. Dr. Benjamin Pessa is survived by his wife, Mira, and his children, Shay and Ryan, whom we all know. He was blessed to see both of his children marry wonderful and loving spouses in this past year and share lots of memories with family. Ben was a sweet, gentle, and affable man whose smile could light up the darkest room. He'll be missed by all. Our condolences to Ryan.
Thank you, Senator Block, and please extend condolences from the Senate as well. Senator Morlock.
Thank you, Madam President. I'd like to rise in adjournment of my uncle, Mike. My father had 5 siblings, 3 sisters and 2 brothers. And I was named after my father's father, Johannes. And my middle names are Maindert and Willem. And so Friday, I lost the M in my middle name. Uncle Mike was born at Huizer Maiden, my hometown in the Netherlands, on October 11, 1930, and he passed away Friday, May 20th in Brandon, South Dakota. He's survived by my Aunt Marilyn, 4 sons, John, Robert, Richard, and Brian, 5 granddaughters and 6 grandsons, and want to remember their families at this time of loss. Thank you, Madam President.
Our condolences to you, Senator, and to your family. Senator Gaines.
Thank you, Madam President and members. I just want to take this opportunity to join in memory of Garner Cal Setzer, and we have his family here joining us this afternoon to honor him. Cal was a man who believed in giving back to his community and did so through his membership to the Rotary Club of Sacramento, the Sutter Foundation, the Sutter Blood Research Committee, the Crocker Art Museum, and his past membership of the Golden Empire Council of the Boy Scouts. An astute businessman, he had been actively involved in Setzer Forest Products, the CHY Company, the Calpine Containers Company, and he operated Winton Ranch. A man who was at home in the boardroom as he was in the outdoors. Cal enjoyed taking in the scenic state of California through skiing, horseback riding, and duck hunting. He is survived by the love of his life of 72 years, Joanne Setzer, his 3 children, 9 grandchildren, and 2 great-grandchildren. Members of Cal's family joined us today in the Senate gallery, actually on the Senate floor, and I extend to them my condolences. I ask that we adjourn in memory of Cal Setzer, a man who did so much for so many. Thank you.
Thank you, Senator Gaines, and our condolences to the Setzer family who's with us today. Seeing nothing further, it appears that the desk is clear. Senator Monning.
Thank you, Madam President. Members, we're going to convene a session Thursday morning at 9:30. We're scheduled for Friday also. Friday stays scheduled, but we're going to meet Thursday to work the file starting at 9:30 a.m. I encourage members to be on time. Many have left already, so please share the word. If you're staff listening to this session Thursday morning at 9:30, Friday's still scheduled for 9 a.m. as well. We're going to make progress on the file and try to get out of here at a decent time for the weekend. Thank you.
Thank you, Senator Monning. The Senate will be in recess until 3:30 p.m., at which time the adjournment motion will be made. We will reconvene this Thursday at 9:30 a.m.